circulatory shock that have effect on all human body. It's due to the damage of tissues, damage of the cells, and this also caused by the disparity of volume and capacity. What is volume and what is capacity? I will explain you here. Look at, suppose we have heart, and heart is surrounded by blood vessel. It is surrounded by blood vessel. If capacity of heart have a capacity to pump blood which is approximately 5 liter. But in the blood vessel, blood is 3 liter. When there is imbalance between capacity and volume, the disturbance happens that affects on all the human body. Imbalance that affect all human body. If there is disturbance happens, what we said, this is known as shock. Different condition happens in different kind of persons. I will explain you different kinds of shock. Our topic today, circulatory shock. Different kinds of shocks in human body. Okay, and circulatory shocks actually it's mean the whole blood vessels that surrounded the whole body. If this system, circulatory systems disturbance, it's mean tissue damage, system damage, organ damage. So let's talk about which kind of this shock. This shock known as hypovolemic shock. Hypovolemic shock. Listen again from me. When there is in a blood vessel volume 3 liter and capacity of heart which is 5 liter, it's mean less amount of blood goes into the system, cardiac system, and when there is less amount of blood goes, it means less amount of volume in the blood, less amount of volume. There is less amount of venous return into the blood, that is known as hypovolemic shock. Another type of shock which is cardiogenic shock. In this condition, when heart muscle fail, there is severe myocardial infarction due to the low amount of oxygen supply into the muscle. When there is low amount of oxygen supply into the muscle, cardiogenic shock happens. Capacity normal 5 liter. In the blood vessel, blood also normal 5 liter. Volume 5 liter. Everything normal. Balance. But low amount of oxygen cause the disturbance, and low amount of oxygen into the cardiac muscle, severe myocardial infarction happens and cardiogenic shock produced. Another type which is septic shock. When bacteria enter into the blood vessel, they produce a toxin. Obviously, when bacteria enter into the blood vessel, they replicate from one to another and they produce a toxin. Due to toxicity, the blood vessel dilate. Blood vessel Due to toxicity, blood vessel dilate. When blood vessel dilate, it means septic shock produced. In this condition, patient died in front of you. Also, another shock which is known as anaphylactic shock. Due to anaphylactic shock, also patient died in front of you. Why? Because of, look at here. Suppose we have system, cardiovascular system. The capacity of blood 8 liter and volume of the blood 5 liter. How much the disturbance? Because cardiovascular system increased blood, but blood vessel don't have too much blood. It means the disparity between capacity and volume caused the anaphylactic shock, and in this condition patient also died in front of you in few minutes or in few seconds. Why? Because of disparity between capacity and volume. And in this condition, did venous return normal? No, venous return isn't normal. Venous return is not normal. Another type of shock which is known as obstructive shock. Another type of shock which is known as obstructive shock. Obstructive in this condition, when large amount of embolus obstruct into the lungs, when large amount of embolus obstruct into the lungs, it's mean low amount of oxygen goes into the arteries. When low amount of oxygen goes, when low amount of blood goes into the arteries, due to the obstruction, there is not normal output. That cause the obstructive shock, that due to this embolus, the effect on all human body. Actually, in all types of shocks, mostly output disturbance. What is output? Output actually, there is not normal condition of venous return into the blood. That's why these kind of shocks produced, and their effect on human body, and human body died. You can treat this kind of shock, but sometimes person isn't survive. Mostly the person isn't survive at a long time. I want to explain you again that what is circulatory shock? Actually, circulatory shock is mean damage of tissues, damage of cells. There is low amount of nutrients and vitamins. There is low amount of nutrients and vitamins into the cells, into the tissues. That's why cell damage, that is known as circulatory shock. This type of shock affect on all body. There are several kind of shock. One is hypovolemic shock. Hypovolemic shock. In this condition, capacity and volume have disparity. Capacity have 5 liter and volume 3 liter. The heart need 5 liter of blood, but in the blood vessel 3 liter of blood. there is not normal amount of blood vessel, there is not normal amount of blood goes into the heart. That's why imbalance and hypovolemic shock happens. In obstructive shock, large amount of embolus obstruct, and large amount of embolus obstruct. Obstructive shock happens because of the disturbance of blood supply into the heart. Output is not in normal condition. And also cardiogenic shock, cardiac muscle disturbance, severe myocardial infarction happens, but capacity and volume normal. Due to the low amount of oxygen, severe myocardial infarction happen and cardiogenic shock produced. Septic shock, it's due to the bacteria. They produce toxins and severe amount of vessel dilate, and severe amount of vessel dilate, it effect on the heart, and this type of shock produced. Anaphylactic shock, in which there is output is not normal, and heart muscle, blood vessel dilate. When blood vessel dilate because of the large amount of cardiac output increased, this is known as anaphylactic shock. Another type, which is neurogenic shock. Neurogenic shock. This type of shock happens, sympathetic tone is blocked and blood vessel dilate. That causes a neurogenic shock. I hope you understand this mechanism.